We've just completed two different ways of taking notes. One is talking to the text, and another model is the double entry note-taking method. Just for fun, we're going to see how well the teacher does taking notes on this article about insurance for children. The title of the article is Don't Deprive the Innocent of Peach Care. So let's say you're at the library and you printed up an article and you have some space in the margin. This might be where you want to write your notes. You might also have a way of copying and pasting the article into a Word document and typing in the side. Either way is fine as long as you're engaging with the author and talking to the text. So let's begin. This article was in May 11th, 2005 by Cynthia Tucker in the Atlanta Journal-Constitution. 7 years ago, when state coffers were stuffed with cash, Georgia officials decided to enlist in a federal program to create low-cost health insurance for children of the working poor. The Peach Care for Kids program was an instant success, covering children whose parents earn too much money for Medicaid but can't afford private health care plans. What's a coffer? So right here is where I might write a question I have for the author. The program sounds like a good idea, though. Now it seems Peach Care, which covers more than 220,000 Georgia children, has become a little too successful. With health care costs soaring and state finances a bit less flush, Governor Sonny Perdue is doing everything possible to hold down program's costs. But why is it too successful? I'm hoping we hear a little more about that later on in the article. That includes instituting a harsh penalty for families who fail to make a premium payment. So, isn't that part of the governor's job? Why is this a bad thing? If parents miss just one payment, the child is dropped from the health insurance plan and locked out for 3 months, even if the parents later come up with the money for the premium. Yikes, this is harsh. Surely the state of Georgia isn't so short of funds that it must deprive working-class children of health insurance for 3 months because their parents failed to make one payment. The state can't be that broke. Or maybe the state really is that broke. That might be something I need to look into later. After all, during the last legislative session, the General Assembly gave away more than $1 billion in tax breaks to various businesses. One bill, pushed by lobbyists from companies such as General Electric, Bell South, and Coca-Cola, changes the corporate tax structure and will save companies a total of about $1 billion over a decade. Another bill cut taxes for smaller companies, making up to $410,000 in capital investments. So in the side here, I may make a comment like this. I know states use tax breaks to recruit new businesses, but these extreme tax breaks sound unfair to the regular citizens who have to make up the lost tax revenue. It doesn't sound fair. Yet another bill gave a special break to agricultural interests, increasing the legal weight limits for trucks carrying products such as timber. The bill is expected to cost the state's taxpayer $300 million to upgrade bridges. If the state can afford those favors for business and industry, why is it being so stingy with its low-income children? Well, is it stingy, though, or just being financially responsible? Peach Care families don't fit the popular stereotype of lazy, deadbeat welfare recipients. They work for a living, but the program does not accept applicants from households earning more than $37,000 a year for a family of 3. Most Peach Care families earn considerably less. A survey conducted in 2002 showed that more than 10,000 of the children covered by Peach Care had parents employed at Walmart. Well, my question would be, are recipients required to work? And what is she suggesting about Walmart? I think I know, but I'm going to read on. Most of the children drop from Peach Care for missed payments, 59%. Woo, 59%, this is depressing. Came from families barely getting by, according to a study by the Georgia Budget and Policy Institute. Their household incomes were more than 150% of the poverty level. That translates to $24,135 a year for a family of 3. Wow, that's not much to live on for 3 people. Far-sighted public health policy emphasizes the importance of making sure that children, all children, get good health care. If children get care for minor illnesses such as ear infections or chronic ailments such as asthma, their school attendance is likely to be better, as is their academic performance. Nor are they as likely to develop more serious illnesses that require expensive hospitalizations. This approach makes sense to me. That's why President Clinton started the National State Children's Health Insurance Program, SCHIP, in 1997. This sounds like a plug for Clinton. Is she saying his program is better or worse than Peach Care? Is Peach Care a SCHIP? He recognized the need to help families squeezed out of Medicaid, which provides health care for the poor, because they made slightly too much money. Peach Care premiums range from $10 to $70 a month. Like Medicaid, SCHIPs are funded partly by the federal government and partly by individual states. But with health care costs bounding into the stratosphere, more and more families in Georgia and around the nation have turned to SCHIPs. Either their companies fail to provide comprehensive coverage or they can't afford the premiums. Given that these are families with little room at the fiscal margins, it's unduly harsh to lock their children out of Peach Care for 3 months for one missed payment. At the very least, the rules should be modified to crack down only after 2 missed payments. I agree, but I wonder, are these arbitrary? 1, 2, 3 missed payments? Georgia can surely afford that much compassion. Sounds strange to put a price on compassion.